Let's see if I can do this right. Guess I should have gone like, there. Hi, good morning. Yeah, it's still morning. My name is Peggy Berry, and I will be moderating a health climate disparity panel with three remarkable individuals. The first one will be Lucinda Cave. She's been a nurse for over 40 years, recently retired from nursing as a professional development educator from the University Hospitals of the Cleveland Medical Center. She remains active in the Ohio Nurses Association as chair of an environmental and community health caucus, as well as the Alliance of Nurses for Healthy Environments. Lucinda is a Annie climate champion, a healthcare without harm climate ambassador, and she recently completed the climate reality training. She's active with Bike Cleveland, an advocacy organization focused on making streets safe for bicycles and pedestrians. Our second speaker will be Rosemary Valedes Chaudry, and I probably pronounced the middle name wrong. She's a good friend of mine. Both of these ladies are really good friends of mine. They are Rosemary is board certified as a public health nurse and in public health. Since her retirement, Rosemary has been involved in advocacy for environmental public health issues, from health equity and social justice issues in public health, and for issues related to public health nursing practice. Rosemary currently serves as the Associate Public Health Nurse Liaison with the Alliance of Nurses for Healthy Environments and to the Nursing Collaborative on Climate Change and Health. In addition to APHN and Annie, she is a member of the Ohio Public Health Association, the Ohio Homes Network, and an Ohio Nurses Association member. Our next speaker is Alan H. Lockwood, MD. Alan is an emeritus professor of neurology of the University at Buffalo. He's a graduate of Cornell University and Cornell University Medical Center, now known as the Weill Cornell Medical College, and was trained in neurology at the University of California, San Francisco. He's a board certified in neurology and a fellow in both the American Neurological Association and the American Academy of Neurology. He is a fellow in both of these, and he's an author of approximately 220 publications on diverse scientific topics, ranging from hepatic encephalopathy, I have problems with words sometimes, but that's the pronunciation, and medical problems with musicians, to functional imaging of the auditory system, tetanus, and environmental toxicants. He's a member of the Physicians for Social Responsibility for over 3 decades and was president of PSR National in 1994, and he's currently a member of their board of directors. He has several books: The Silent Epidemic on Coal and the Hidden Threat to Health, and a second book on Heat Advisory, Protecting Health on the Warming Planet. And there's a free read in that, and I will probably put it in the chat for everyone. And on Heat, Fire, and Water, How Climate Change Has Created a Public Health Emergency. That was published in 2019 and is also free. He lives with his wife at Kendall in Oberlin. I'm going to ask Lucinda first to do her presentation, and we will, let's see if I can pause share, and I have to figure out how not to share anymore.
So just hover
There it
towards
is.
the
Got it.
stop. You got it? Okay.
Got it. Couldn't find it on my screen. Lucinda, looking forward to your presentation.
Okay, before we get to 100, I thought I'd mention one way one person can save one planet on two wheels and even become healthier while doing it. And then together with efforts from a lot of other people, that person can even help support environmental justice. As probably most of you know, transportation is responsible for one of the largest shares of US greenhouse gas emissions. And about 2/3 of that, well, as this slide says, 29%, and that does vary from year to year. About 2/3 of that comes from burning fossil fuel for light duty vehicles, our cars and our trucks. And then over 90% of the fuel used for those transportation vehicles is petroleum based. According to the EPA, a typical passenger vehicle emits 4.6 metric tons, which works out to a little over 5 regular tons of carbon dioxide per year. That's about 0.9 pounds of carbon dioxide per mile. So that means if a driver has a 5-mile commute to work and back in a gas-powered passenger car, he or she emits about 9 pounds per day. That's just going to and from work for 5 miles. Multiply that by 5 days per week and 48 weeks a year, because we'll give them 4 weeks off for vacation. He or she emits over a ton, 2,160 pounds of carbon per year just going to and from work. So add in other bikeable errands to the store, to the library, to the post office, and it all adds up until we're 100% driving electric vehicles. Bikes can save the planet a lot of emissions. Biking is one activity for which the expression, what's good for the planet is good for the body, applies. For the planet, decreased emissions, and for the body, lots. Biking is one activity for one 2017 study suggests that the people who cycle to work experienced improved cardiovascular functioning, 46% lower risk of developing cardiovascular disease, and a 52% lower risk of dying from cardiovascular disease. Cycling may also help reduce blood pressure over a period of time, up to 11.8% after 6 months. A 2019 systematic review of the health effects from cycling indicates that cycling is useful to help reduce body fat and body mass. If you bike for 30 minutes, depending how big you are and how fast you go and how responsive your bike is, etc., you can burn around 300 to 350 calories. If you walk for that 30 minutes, it's about 130 to 175 calories. Compare that to burning around 100 driving a car for that 30 minutes, or only 50 sitting in that car as a passenger. Cycling can help a person manage their weight because it increases metabolic rate, builds muscle, and burns body fat. An older study from 2011 notes that cycling for about 200 minutes per week can greatly improve lung health. And one source added that exercise such as cycling can even keep lungs healthier, even for people who already have a lung condition such as asthma. In one sample, more than a million people in the United States, exercise such as cycling was linked to improved mental health. And then another study found improvements in some cognitive functions. Because it's low impact, cycling can accommodate people who have a variety of injuries or disabilities while still allowing that person to become active. And it can stimulate the motor regions in your central nervous system and activate the areas of brain which can help balance. Cycling also helps a person improve their core stability, which also improves balance and helps to prevent falls and other injuries. However, cycling, especially on our roads, invites the question, what about breathing in all the emissions from all the other cars and trucks while you're commuting? It's a good point and something worth looking into. Again, until we reach 100. Experts have determined that overall, the benefits, which I just outlined from cycling, outweigh the risks from breathing in air traffic emissions, but encourage that cyclists reduce those risks by biking less traveled roads or going at lower travel times. And often a bike commute is not the same route that you would take if you were driving a car. And then, of course, the other health consideration is safety. According to the US Department of Transportation, 843 bicyclists were killed in bike car crashes in the US in 2019, and 47,000 more were injured. A cyclist or a pedestrian will lose in any run-in with a car or truck. Causes are the same as for car crashes: speed, distracted driving, or distracted cycling, drivers or cyclists under the influence of alcohol or other chemicals, and poor visibility. And just as making the switch from fossil fuels to renewables takes a huge change in our public mindset, so does redesigning our city streets for bicycles and pedestrians, as well as cars. For too long, our streets and roads have been built just for the benefits of cars and trucks only. So creating better bicycle infrastructure can be another source of climate change related jobs. It takes a lot of planning and development to build and maintain desirable connected bike infrastructure, but when it's done properly, it can decrease emissions, improve health, and it is especially important to add bike infrastructure equitably, even more so in areas where people of low income may not own or have access to a car. Advocating for equitable bike infrastructure so all people can enjoy fewer emissions and better health is an act of environmental justice. And I'll just point out a few of the features of the pictures here. The best city bike lanes are built with some kind of vertical structure separating them from the cars. Another really good feature are bike traffic lights, set to go off, timed, so bikes get to go a little bit sooner than the cars, avoiding, like, say, this car turning left in front of the cyclist and causing an accident. So those are just also involved in the planning is, where are the cars going to park? Because if you have a car parked right in the bike lane, that sends the cyclist out into the road again, which is another source of accidents and injuries. So that wraps up my one suggested way for one person to reduce emissions, improve health, and then with extra involvement, build effective bike infrastructure in an equitable and just way. Wouldn't that be a great way to go?
It would be. It would be. So now we're going to hold the questions until after all the discussions. Rosemary, we would like to hear from you.
Okay, good morning, everyone. I'm Rosemary Chaudry.
Rosemary, we don't hear you well enough.
Can you hear me better now?
Yes.
Okay, it's a pleasure to be here to talk with all of you a bit. I don't know if my slide, who's doing the slides? I sent it in.
I've got it. So let me pull that up for you. Can you remind me which one?
I think it just says ready for 100.
Oh, I
I
got
forgot
it.
to put my name on the title. Okay, thank you. So my slide, I only have one slide, and I apologize that it's not colorful and beautiful like the other one, the set that you just saw. But I'm going to talk a little bit about, can you make that a little, yes, thank you. I'm going to talk a little bit about all three of these major groupings that I have there, because I am representing public health in this conversation. So I wanted first to set some basic information about where we are as a state in our use of energy. And as you can see from that first item there, total energy use per capita or per head, per person, we're about close to the middle. We are 23rd out of 50. We are grouped in with the second highest group of energy per capita states. The more alarming one, oh, I don't know what happened there, but it moved. Oh, thank you. Is the amount of carbon dioxide emissions that we put out. And we are 7th out of 50. We are in the highest group. We are joined like by Illinois and Pennsylvania, but states that do a little better than us, even a little bit, Indiana, New York, Michigan, Wisconsin and Minnesota. And I mention those states because they are all in the Great Lakes. And so they are comparable to us in geographic location. And so that's a bit alarming to see that we are that high, I would think. And then moving on to preparedness, which is a core concern for public health. We want to try and prevent adverse effects in the environment and promote health through that. Our state has not put forth a climate plan. There are many states that do have a climate plan. I see Oberlin has. We have many colleges and organizations, public and private, private, that have put forth climate plans. And we have 3 cities that have led the way. But unfortunately, we do not have a climate plan at the state level, which is a gap in helping all the communities across the state tap into a resource that could help them with formulating their own climate plan. And so this bottom section here talks more about public health. And public health has been defined, it was defined in the late 1980s in a federal report put out by the Institute of Medicine that defined public health as what we as a society do collectively to ensure the conditions in which people can be healthy. And that definition, there are other definitions of public health, but that's really important because you see key words in there that say it's what we all do collectively. It doesn't belong to one entity, one industry, one community. The global environment, the environment that we share is a collective entity. And so public health, by definition then, is concerned with what everybody does in all locations and in all areas of life to assure the conditions in which people can be healthy, whether that's medical care, whether that's construction, whether that's landscaping, whether it's farming, whether it's manufacturing, whatever it is, it's a common responsibility. So right up there in number A, I've listed human activities contribute more carbon emissions than any other source, and some examples there. And then I've moved into a few key areas. I know the next speaker is going to be talking about heat issues. So I did not get into that, and that's a very important one. So I'm glad he's addressing them. But I did focus a bit on air toxins, or those pollutants that come from those carbon emissions and the smog that we get. Many of those pollutants that we have in our air are already known, and others are highly suspected, not yet proven, to be causes of cancer. And those air toxins impact people who already have issues in cardiac health, in circulatory health, their immune systems, for whatever reason, might be compromised, neurological issues, respiratory, and also reproductive health issues. And I'll talk a bit more about that as we move down to infant health. But so we know that a lot of the things in the air that are coming from those emissions are very bad for people that already have existing illnesses, and also bad for contributing to the beginning of those conditions that are affected by poor air quality, starting other health issues for people. Asthma is a big problem in Ohio. There's been an asthma coalition in Ohio. Oh gosh, when I worked in Medicaid in the late 90s, there was one. You see the number there, 1 in 12 Ohio children, 1 in 11 adults. We know that there are documented disparities by race with minorities bearing the brunt of adverse health effects, of mortality. By sex, women have worse respiratory health due to asthma and outcomes than men, or persons of low income, and place of residence. And a little more information on our state. 6 of the cities in the top 20 for the worst places to live if you have asthma are located in Ohio. And so when there is bad weather outside, whether it's too hot, whether it's humidity, poor air quality, warning people to be in. Indoor carbon dioxide, oh, I'm sorry, I forgot to drop the size of that too there. Indoor carbon dioxide exposure rates that people have, whether they're often in homes, in work sites, shopping areas, whatever. Exposure rates are already documented in many areas, particularly in homes, to be worse or to exceed what's considered safe levels. So again, that bad air is coming in. There are things that people do indoors that contribute to adverse air, but the key thing is that it's not always healthy outside, and it's often just as unhealthy or even less healthy inside. So on to fetal and infant mortality. Many of you probably know, particularly if you work in healthcare and in women's health or infant health, that Ohio has had a persistent gap in the mortality rates of children before birth, and particularly infant mortality, and that's mortality for children from birth up to 1 year. The rates for African-American children for dying at that young age is more than twice what it is for white children, and also higher than what it is for Latino or Hispanic children. This is a big problem in Ohio. We've been addressing it for years. And we now have also worries besides inadequate health care or poverty and nutrition. We now know that there are links in infant mortality to poor air quality, and we see those same disparities by race. So the things that I've talked about here are all pretty much environmental justice issues. And environmental justice is not in place when we have disparities, which means that we have differences in health events or health outcomes that differ by, again, those key things like your race, your income, your sex, where you live, your education. And that's a big problem. There's a lot of focus on health equity. I put one last thing down here in addition to the health information I put there. We also know, it's been documented, that power plants are much more likely, higher than the state median, which means the midpoint, much more likely to be located in areas where people are poor and where they are minority. And so again, this is a huge concern for public health. All of these things I put here, not inconsistent with other things we've heard, but something to be mindful of, that what we are doing as a society to assure the conditions in which people can be healthy is not keeping up with the knowledge we have about environmental justice, health inequities, and policy and social inequities. And I thank you for listening. And again, thanks for letting me be part of this discussion.
Thank you so much, Rosemary. And again, we're going to hold questions till the end. You can, of course, write your questions in the chat, because I actually asked a question and I got answers from multiple people. Another thing is that if our speakers want to put links into the chat for other people, please feel free to do that. Now, our next speaker is Ms. Dr. Lockwood. Sorry, Dr. Lockwood, and he will be presenting on heat. Dr. Lockwood?
Thank you very much. I really appreciate an opportunity to talk to this group today. I'm going to focus, I've been long interested in environmental health problems, and this morning I'm going to focus on heat. It's hard to escape the fact that it's been pretty hot outside recently. Unfortunately, or perhaps fortunately for us, we don't live in Phoenix where my sister does, where it's been 118 with great regularity the last few days, cooling off to an overnight low of just over 100. And this morning, the New York Times had an article about an impending heat wave in the Pacific Northwest, where temperatures are expected to set records with temperatures over 100 to maybe as high as 104 in Seattle and Portman in the next couple of days. And buried in that article is something that those of us who have been paying attention to heat have known for a long time, and that is that heat is the leading cause of weather-related deaths in the United States. Now, the United States Weather Service maintains some of these statistics, and they tell us that between 1990 and 2019, there was an average of 148 deaths per year due to heat. And this is really a serious underestimate. The Centers for Disease Control looked at this and published data that are much more accurate. And they write that between 2004 and 2018, there were 702 deaths per year. And these deaths were highest in men and those over 65. Thank you very much. That's me. A still higher estimate for the number of deaths in the United States per year was published just within the last year. And these authors estimate that there are 12,000 deaths per year due to heat in the decade ending in 2019. And if we continue a business as usual greenhouse gas emission scenario, this is going to rise to close to 100,000 deaths per year in the last decade of this century. I'm going to see if I can. Okay, well, that looks pretty reasonable. Let's take a closer look at who is at risk. And one of the best sources, not quite yet, one of the best sources of this information comes from epidemiological studies of the Chicago heat wave in the 1990s. This caused around 700 deaths in just about a week. The median age of those who died was 76. And you don't have to be a statistician to know that that's a higher number than the average age of people who live in Chicago. And public health researchers went out and interviewed case control people and examined the people who died and found that, not surprisingly, among those of us who are old, those of us who have chronic disease, take a variety of medications, are bedridden, not able to get out and about, those who live alone, and interestingly, those who live on the top floor of buildings where heat will rise up to the top and cause excess mortality, particularly if the roof of the building in which you live is black. Now let's take a look at what's going on in some of the cities. And are you going to control that, or do you want me to do that?
Got it.
Got it. Okay, great. Thanks. I can't imagine that there's anyone in the audience here that has not heard of redlining. And this is a map of redlining in the city of Cleveland that was produced by the Homeowners Land Corporation. And it gave rise to a number of unfortunate things, including a great deal of the inequality that is gripping the country at the present time. Now, the authors of a study that I'd like to refer you to, and there's information about this in the pamphlet that I hope you will all have an opportunity to receive and look at. The authors of this study looked at 108 cities in the United States and used satellite temperature data and compared the summer heat in redlined areas of these cities compared to the areas that were green. Hopefully you can see this pointer where the mortgage risk was judged to be the best. And they found that on average, the redlined areas of cities were 4.7 degrees hotter than the areas where mortgage risk levels were judged to be best. And Cleveland is typical of that. In the redlined areas, 4.9 degrees hotter in redlined areas compared to the green areas. And the links that show us what is responsible for part of this is not surprisingly the built environment, which is where I've lumped all of the things that have to do with construction, parking lot areas, and buildings themselves. And also interesting for me, since I'm chairperson of the Arboretum here at Kendall at Oberlin, is the tree cover. Tree cover is really important. And one of our speakers we heard earlier said that their city had just spent a reasonable amount of money to plant new trees. And this is one of the ways that cities can cope with heat. Now, one of the penalties that's associated with living in these redlined areas is it's hotter. And if you have air conditioning and climate control systems, you're going to be spending more money on electricity to cool your home if you're fortunate enough to have air conditioning. And that problem is going to be even worse if you're not able to afford the weatherization that can protect your home against the heat gradients between an air-conditioned interior and a non-air conditioned exterior. Of course, the reverse applies in the winter, but we're talking mainly about heat. So one of the tools that the Centers for Disease Control has produced are these so-called social vulnerability index. If we can see the next slide. The social vulnerability index is composed of four components. There's a socioeconomic status, household composition and disability, minority status and language spoken in the home, and housing and transportation variables. Now, each of these, say the household composition and disability, has as one of the factors that contributes to this index is the number of people who are 65 or older, whether you have a disability, single parent households. Now, the CDC created these social vulnerability indices as a tool that city planners can use to prepare for emergencies of various types. And heat is one of these emergencies. Now, also, so keep this in mind, these social vulnerability indices. Also on the CDC Social Vulnerability Index website are interactive tools that you can use to determine how hot your city is likely to be at some time in the future. And if we can see the next slide, please. These are available for cities, for counties, or down to a census tract level of resolution. And these are the two census tracts that enclose the city of Oberlin, which you can find if you Google Census Tract Ohio, you'll see a map, and this is cut out from that. We have two census tracts, 601 and 602, in the city of Oberlin. So there's a highway that separates the two halves. It's going to be very busy this evening because lots of people from our congressional district will be heading south to see, as the former guy, Donald Trump, who's giving a rally in Wellington this evening. Next shows how these census tract data can be used to create a picture of what the vulnerability in your community. So the vulnerability score ranges from 0, which is best, to 1, which is highest. And there's some complicated statistical techniques that go into the creation of these social vulnerability indices. So one of the things that you see on this maps of heat vulnerability is that the prediction for this particular census tract, by 2050, there are going to be 15 more days with temperatures above 95. The overall social vulnerability index for this portion, which is mainly eastern parts of the city of Oberlin, is 0.59. And a great deal of that is due to the household vulnerability section. If we skip to the next slide, which is the other Census Tract 602 in Lorain County, we see now that the overall vulnerability score is 0.294. And if you look at this household composition and disability score, you see that that's really, really a very small portion of this. Now, it just happens, if you know where the professors from the college live, they live mainly over here. They tend to have nicer homes. And the lower socioeconomic category people live more on the east side. So that if you want to use this information to gain information about where you live, and you can tailor presentation and information and action by city governments based on these vulnerability indices so that you get the best bang for your buck and do the most good for various people. Or if you're like me, where you sort of do a traveling dog and pony show, you can tailor your presentation to the community where you're appearing and speaking in order to make it more relevant to the audience that you're talking to. So thanks again for the opportunity to be here. There is a pamphlet that's 5 pages long that I've sent on to the organizers, which I hope they can distribute to people who are tuned in here this afternoon. I guess it's afternoon now. Oop, not quite, minus 3 minutes. So thanks again for the opportunity to be here, and stay cool, stay well, stay safe. Thank you.
Thank you so much, Dr. Lockwood. We have time for some questions that we can direct totally to our speakers. I'm curious, when I look at all of this and how the elderly are so, wow, they're at risk for heat deaths. And what can we do to help them when we have a heat advisory going on, Dr. Lockwood?
That depends upon where you live. The city of Oberlin and Cincinnati and other cities in Ohio have climate action plans. And one of those plans, one of the action aspects of that is a strategy to move vulnerable individuals, people who are homebound, bedbound, away from the dangerous environment in which they might be living into a safer environment, such as a library, a shopping center, mall, or some other cooling center for the duration of a heat advisory. Now, we can do that more effectively now because weather forecasting is a whole lot better, and the weather is it's a big deal if you tune into local news. Chicago was caught largely unprepared. I mean, the Weather Service forecast this heat wave, but nobody paid much attention to it, and there was no plan to deal with the possible consequences.
So until they knew that this was happening and public health cited the deaths as heat related, nobody was going to do anything about
Right.
it.
Now, a more
Further.
proactive approach to this, which is going on in a number of communities, including Overland, is to do home energy assessments, which can be done free for any resident here, and information about how to weatherize your home. And here in Overland, we have funds available through our sustainable, I'm blocking on the name, there's a fund of several $1 million that comes from tax rebates that go back to the city uh, that are available for funding projects to make the city more resilient from climate activities.
Okay.
And I would add to that, for anyone who has questions or concerns about the level of preparedness in their community, particularly for vulnerable groups such as older adults, to contact your local health department or your local emergency management um, EMA, and ask them, what kind of plans do we have in place? How can I get a copy of this plan? Or, where do we go if something like this happens? Many of them, if not most, or maybe even I'd like to say all, I don't know, have been working on this because this is a major health challenge, particularly for older adults.
Yeah.
And those are, the same folk that are suffering from disparities in other areas. This is the same.
Lucinda, you were going to add?
Yeah, I would add, it's so important for certainly people living alone, elderly people living alone, to have someone who calls and checks on them or goes and visits and checks on them at least every day, especially during heat waves. That personal connection would be, and looking out for one another is so important.
Yeah, social isolation is an important risk factor. You're absolutely right, Lucinda.
Okay, but one of the other things is with climate change, I became more aware of that in 2009 when Hurricane Ike winds came through Dayton, Ohio, and it knocked out my power for 9 days. Because of climate change, we are going to see these extremes with our weather. And one of the things I find so important is that methane is one of those greenhouse gases that is 95%, what is it, 95% more powerful than carbon dioxide. And we have to reduce our dependence on it by getting ready for 100% renewable energy. So I was going to go to Rosemary and ask her about some of the programs that will help with healthy homes for not only our elderly, but for our socially and economically disadvantaged, our people of color.
Yeah, there's been a long time focus on trying to work on things like weatherization to improve safety and health conditions in homes, particularly for people that have income issues. Unfortunately, they're not always well funded. And that does leave a big gap in the working middle class group who have, these are major expenses oftentimes to deal with things like leaks, mold, mildew, whatever. I know Ohio Healthy Homes Network, which I'm a member of, they have information on that. Ohio also has information on that. I'm not sure that Ohio Department of Health can add much to that. I don't know. I haven't been in touch with them for quite a while. But again, local health departments, if you need, I would call the local health department and ask for the environmental health section. And they can probably point people at a local level to what resources are available and go from there.
Yeah, Kathy Cullen Becker put in a comment, the problem with energy efficiency in low income areas is people don't have the money to pay for the upgrades, like the new insulation, the new appliances. And in Columbus, our new community grants help with that. And we really do need to look at what we can do to secure more grants and funding to help bring up those changes necessary for energy efficiency. And it would be nice if our state government was happier with renewable energy too, which is why we work on Ready for 100 at the city level.
So Peggy,
Lucinda,
there's also a social justice issue here, and that's for people who live in rental housing, where you often, not always, but often, it's not rare to find those rental housing units that are not kept up for whatever reason, and it's hard to enforce that. But that's a huge problem, particularly for people that are of lower income.
Well, that's a problem here in Oberlin, and I think Savannah, it was that alluded to that in Cincinnati, that it's difficult to figure out how you can persuade or incentivize owners of rental properties to upgrade the weatherization and acclimatization of buildings that they live in. They don't pay the electricity bills, so they have low incentives to do that. That's one of the things we're working on here as a part of our climate action plan.
all right. So, we only have about, 5-7 minutes before we go on break. Is there anything that any of you would like to stress before we put over into break? Lucinda?
Just in keeping with my topic, the best time to change a street or road over to bike and pedestrian friendly is when that road is going to be repaved or resurfaced, if you can't do it right from the start before the road is even built. When you've got an influx of infrastructure funds, that may be the ideal time to do it.
Okay. Rosemary, closing statement?
Let me just put out a plug. I've heard an expert referred to as a person from out of town with slides. Willing to travel, have slides, electric car on order.
I'm kind of waiting on Subaru to put out their what is it called? Terra something. Solus. It's going to be an electric car, and I'm waiting for it. That's in 2 years. Rosemary, is there something you want to add to the discussion for closure?
No, I think the points that have come out are not surprising. We know the key thing is, I think, in many ways, so I guess I am going to say something, is that this is very much a local, something that needs to spring from the local level. And I put a link into the Ohio Climate Resilience Plan that Ohio Public Health Association did, and they will do again. But, everything is local. And so communities have different needs, different assets. And so I think that it's our obligation to try and get things rolling at the local level and just try to hope it bubbles up to the state, maybe even regional, but definitely local.
Okay. Dr. Lockwood.
Yeah, don't forget letters to the editor, op-eds. Legislators read those. Much to my surprise, I had an op-ed published in the Cleveland Plain Dealer just about the 50th anniversary of the founding of EPA. And I got a very nice handwritten note from Sherrod Brown. I mean, so I know he read that. So don't neglect your federal and local legislators. And EPA too, there are often opportunities to comment on pending rules and regulations. They take those into account.
Understood. Yes, just last week, the EPA had a panel discussion on the methane rules and how everybody wanted to put their their opinion in as far as methane reduction. And for me, it was like, with all due respect, guys, I've been talking this since 2012. And we really need you to keep up the work and keep it going instead of having our people in power rescind stuff when health for our people is so important.
Yeah, it's very encouraging that the Biden administration is moving to nullify the rescinding of the methane emission regulations that were promulgated during the Obama administration. That's really critical because methane, as you pointed out, is a much more potent greenhouse gas than carbon dioxide.
I was very encouraged by that. The vote in the Senate for the rescinding of the methane emission rules came shortly after Peggy and Rosemary and I spoke to the health and environment aides of Rob Portman. And Rob Portman was one of the few Republican senators that voted for the more controlled methane emissions.
Wonderful. And now that we are like 10 minutes over, I guess it is time to wrap it up. Thank you all for this great conversation of why Ready for 100 is so important to this nation to decrease our methane use. Thank you so much.